119 Homer City.
It is the voice of Indiana County, WCCS 101.1 FM, AM 1160, and WCCSradio.com, 11 minutes after 8. And Dr. Matthew Nettleton is with us this morning. Our conversation brought to you by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people, and Dr. Nettleton helping us to put a cap, if you will, on Men's Health Month. June is Men's Health Month. We're getting toward the end of the month, but it doesn't mean you get to quit paying attention to your health, guys. That's why he's here to tell us all about that. Good morning.
Good morning.
It's good to have you with us here today. Let's talk a little bit about men's health and start with where we should all be starting, and that's at our primary care physician. That's important, isn't it?
Yeah, absolutely. That's the first step, is to establish with a primary care doc. If you don't have one, you got to get one. If you do, you want to schedule an annual physical. Very important.
Is there an age at which guys can say, okay, now I'm going to start paying attention to this and I should start going to the doctor? Some people say 30, 40, 50, whatever it happens to be. Or should that be something that we've been doing ever since we were kids?
Actually, even after the age of 20, you should have visits with your doctor, not necessarily annually, but maybe about every 3 years. I mean, there's no perfect guidelines on this one, but about every 3 years. Mm-hmm. There should be some assessment, even for cardiovascular risk, even people in their 20s.
Yeah, we're hearing, of course, about things when we have Dr. Clark on. He talks about the fact that colon cancer is being discovered at a much younger age in guys now.
Exactly.
And ladies, too.
Yeah. And that's why they lowered the age from 50 to 45 a few years ago in response to that. That's a very important test. Unlike a lot of the other screening tests, colon cancer screening actually can prevent colon cancer. Tests that we have for prostate cancer screening, breast cancer screening, these tests detect cancer early enough. Hopefully you can do something about it. But colon cancer screening, you can actually detect it before it's cancer. If someone has a polyp, you remove it, it never becomes a problem.
Yeah. So when we're thinking about guys specifically, since we're talking Men's Health Month,
sure,
we automatically think of prostate cancer,
of course,
as the big thing that we need to check for, and we do.
And we do, yes.
Are there other concerns for guys that they should pay particular attention to?
I mean, we're always concerned, and this isn't necessarily unique to males. I mean, well, I shouldn't say that. Males, say, age 15 to 35, a little higher risk for testicular cancer. So that's something, I mean, all males should kind of be doing self-examinations. And of course, when they see their doctor, they should be getting examined as well. But typically, that's very rare. They don't really have a set screening test. There's no blood test, no X-ray or imaging for that. But prostate cancer, of course, very important. 1 out of 8 American males will be affected by prostate cancer, which is a huge statistic. And it's a simple test. Just you get in, see your primary care doc. They'll order a PSA once a year. Typically, we start at age 50. Age 50 is the time to start, but if you have a family history, or actually our African-American population, they actually should start earlier.
Yeah.
Mm-hmm.
And the treatment for prostate cancer, that whole protocol has changed over the years, hasn't it? And often. Yeah,
there's a lot of options for treating prostate cancer. Varies from radiation treatments. We have seed implants. We have something called external beam radiation. And then, of course, removing the prostate. And a lot of that's done now by robotics. So the recovery time's a lot better. Mm-hmm. There actually are some cases where you just simply, you know someone has prostate cancer and you just simply watch. You don't do anything, but just sort of watch it over several years before you do anything.
Monitor for growth.
You just monitor, especially based on age. I mean, if someone's older with prostate cancer, it's kind of ironic because, the longer we live, the more chance we have of getting prostate cancer, but the less chance you die from prostate cancer. So if you get diagnosed in your 70s, the chance of you dying from that is low. If you're diagnosed at 50, it's an urgent matter.
Yeah. So that's one very, very important part of a man's health, and certainly something that we need to take very, very seriously. What other screenings should guys go for typically?
Yeah, and then all the standard screenings. They're not just unique to males, but it's very important. There is a higher risk of cardiovascular disease amongst males, so we definitely want to get screen people for hypertension at their annual physical. Look at their cholesterol panels. With a cholesterol panel, we can actually determine what is your 10-year risk of a cardiovascular event. We just take a number of variables from your age, your sex, and actually look at your cholesterol numbers. And depending on that, we can actually calculate what your risk is, and that's important.
Yeah.
Because that determines how aggressive you are about treating it, whether you need medications or you continue with lifestyle
Yeah.
modifications. Yeah.
Yeah, and that sort of leads into the general discussion of what is a healthy lifestyle to be leading, because heart health is so much a topic these days.
Yeah, yeah, and so that visit, that's also important for the for the doctor, just to encourage healthy lifestyle habits, good sleep, a healthy diet, low in saturated fats, low in processed foods, which is very difficult these days, and of course exercise. Exercise is really important, and sometimes people think they have to do a very rigorous exercise program, but even if you just walk for 30 minutes or so, 5 days a week, it has huge benefits.
Of course, we live in Western Pennsylvania, and some folks, they say, well, in the summertime, it's too hot. I'm not going to get out there and do that. As you were telling me, your son's living in
Arizona.
in Arizona right now. He knows what hot is.
115 degrees, yeah.
Yeah. But then we'll also say that in the wintertime, it's like there's always an excuse.
There's always an excuse. But I think everyone knows you have to take that time to take care of yourself. I mean, it's very important. That's why we have gyms. We have places indoors where we can do all that.
Yeah.
Swimming is great. Swimming is excellent, and that you can do year round. And that's great for people that are older, people that have joint problems, because it's very low impact on the body. Mm-hmm. So I'm a big fan of swimming.
I wanted to get into joint health again, because that can impact your health in a number of different ways. If your legs don't feel good, your hips, your knees, whatever it is, if they don't feel good, you are less likely to want to exercise. Those things can be taken care of, I don't want to say easily, but they can be handily taken care of.
They can be taken care of. If someone has osteoarthritis afflicts so many people, there are regimens we have for people to manage their pain. Sometimes you can't completely manage pain. Of course, if it's severe enough, they may need a joint replacement. It's definitely important to get that taken care of so you can try to live a healthy lifestyle.
Talking with Dr. Matthew Nettleton during Men's Health Month here on Indiana in the Morning, you mentioned diet, and certainly that's something that everybody should begin paying attention to, probably much younger than we do.
Yeah, actually. So they've done studies, and this maybe sounds kind of morbid, but even in pediatric populations, postmortem studies, when they've looked at a child's vasculature inside a blood vessel, they even start laying down plaque at a young age. Even as children. And then, of course, that plaque progression, it just depends on your lifestyle and genetics. And, of course, if you smoke, you eat 5 cheeseburgers a day, you don't exercise, that plaque progression happens quicker, and it may become critical at a later age or even an earlier age.
Smoking,
of course. Yeah, smoking. I mean, we always encourage people to, quit smoking, or certainly don't start smoking. Yeah, that's a tough one to lick. Nicotine, it's actually second to opiates in terms of the hardest drug to quit. Wow. Yeah, to opiates. This is number 2, which is unbelievable. But of course, some of that is the accessibility of it, but it really gets a hold of you.
Alcohol and substance abuse as well. Those are big factors in a man's health.
Sure, yeah. And I drink alcohol myself, but we just have to be, everything in moderation is the key. As a rule, we tell men no more than 2 drinks per day. That's about the most your liver can process in a day. And when I say a drink, I don't mean a heavy pour. I mean, a beer or 4 ounces of wine. And women, it's 1 drink a day.
Yeah. Mm-hmm. Guys have a tendency to say, I know it'll catch up with me someday. People have been telling me that all my life. But it can catch up with you a lot quicker if you're not doing the healthy things in your life. And we're reluctant to go to the doctor, aren't we?
Yeah, I think a lot of males are. I think that trend is changing, though. I mean, I don't know if it's the information highway, the internet, smartphones. I mean, you're bombarded with health information all day. So I'll have patients. My male patients now, they're coming to me. Hey, are you checking me for diabetes? And I'll say, yeah, I check you every year for diabetes. They're not even aware that I'm checking them.
Oh, yeah.
Yeah, we're checking you for diabetes. I think the people today, they're definitely more savvy, more knowledgeable, but they still have a ways to go. Still a ways to go, yeah.
Yeah. But that medical connection with the medical professionals, the people who know what they're talking about, is such a vital link.
Correct. Very important. I mean, there's a lot of information out there. There's also a lot of bad information out there. So I think it's good to have a discussion with your doctor to discern, what's credible and what's not credible. We use some different sources than the general public
Yeah.
to gain our knowledge, and most of it's we try to do as best we can evidence-based medicine, things that have actually been tested, and does this work? Does it not work? So
Let me take you back a couple of years to the pandemic and its effect on our health today. Are we more or are we less, or is there no noticeable difference in the way that we think of going to the doctor and using the medical professionals that are out there for us?
That's a tough one for me to answer. I don't really know on that one. I mean, I think COVID right now, it's definitely, fortunately, has died down in incidence. But it's still an issue. It's still, I mean, it can still affect people. There are, it's really tough because a lot of people, they don't. There's a mindset. I see it. Some people are all for vaccinations. They're gung ho. They're very adamant about it. And I have other people that are very leery, suspicious. And I honestly think it has to just do with the political times. I mean, it just depends on who's in office. It determines what people do and how they, whether they get a vaccine or not, which is really not the way they should be making those decisions. But like I said, right now, COVID is still an issue. We still have cases. We still encourage vaccinations at this point. I'm hoping that this, because coronavirus has been out forever. It's been out for centuries. Okay, it's just that this was a mutated version, a lethal version. We're seeing it sort of mutate into something a little bit more natural, because coronavirus has caused cold. When people have colds in the fall, that was very likely a coronavirus. But now this one was just like amped up, essentially. Yeah. So, but it's still challenging.
Dr. Matthew Nettleton, our guest here this morning on Indiana in the Morning. We're talking about men's health. Let's get back to where we started. Primary care physician. So very, very important. Not so hard to find a primary care physician.
No, there's a lot of great primary care physicians. I mean, I'm not here to plug our group, but we have a very big group. We have actually 7 providers. We work out of 2 offices here in Indiana and also at IRMC's Chestnut facility. So we have 7 providers. There's 3 doctors, including myself. We have 2 nurse practitioners, 2 physician's assistants. But there are, there's plenty of hospital-employed primary care physicians that could service the community. You just have to reach out. You just have to, make that call and call the hospital. They'll get you connected to one.
Get it done.
Get it done. Get it done. I mean, these things are so important. I mean, you can actually, that old adage, an ounce of prevention is worth a pound of cure. It really holds up, and that's what we do. That's the bread and butter of what we do as primary care physicians.
Yeah, sometimes I feel like this conversation would be better directed at the ladies because they're the only ones we'll listen to. So wives,
that's true.
wives, get on the guy and get him moving. All right. Somebody wants to get in touch with your group and get affiliated. What should they do?
They can call our office. They can actually, even if they call the hospital switchboard, everyone knows our group. They can get connected to us. So yes,
terrific. Thanks for the visit. I
appreciate it. Yeah, I appreciate it. Thank you. Thanks for having me.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, WCCSradio.com. And coming up just a couple of moments away from now, Boomer Sports, and then Josh from the WCCS Newsroom.